I'm just thrilled, and I know I'm speaking for Mr. Chrencik and Dr. Suntha in seeing this crowd here. You're terrific to come out. Welcome, everybody. It's very good to have you here. Can I just see a show of hands? Who are the folks that get their paychecks from UMB? Raise your hand. And the folks that get their paychecks from the system in the center? Good. So a very good mix of people, but I want to focus my remarks on the people that are members of the university community, because we're here to celebrate our relationship with our partners. For the university folks here, this week the system, the University of Maryland Medical System and the Medical Center are celebrating their work and their mission. They call it Spirit Week, and they honor thousands of team members across a dozen hospitals who undertake that work and live that mission every day. The Spirit Week theme, I understand, is be a part of something greater. Is that right? Okay. And that's exactly why I asked Mr. Chrencik and Dr. Suntha if the relative, if UMB could join their celebration, because the university is part of this something greater. We're a better university because of our relationship between the medical system, or with the medical system, and the hospital. We're enriched by all that we share. We share people with tremendous talent and dedication, all of you in this room, the commitment to a community, and of course our work to improve human health and well-being here in Maryland and really around the world. And that's something very special that we're able to accomplish together, that we can turn the knowledge that's created into care that heals, that we can join teaching and practice to develop the most capable, most compassionate core of health and human services professionals. Everybody knows that the medical system and the medical center serve as UMB's key platform for training the future providers of care in Maryland. Now, all of you certainly know how closely our School of Medicine works with the hospital. Critical relationship, wonderful relationship. But I should say that our partnership is broader than that. It extends to our School of Pharmacy, where a joint residency program prepares pharmacy graduates who want to work with patients in a hospital setting. And I'm just giving examples, there are many. Our School of Dentistry, where pediatric dental residents are on call 24/7 for children who need emergency care at the medical center. The School of Nursing, where a nurse-managed urgent care center was recently opened to alleviate long wait times in the hospital's emergency department. School of Social Work, which provides staff to the system's provider networks so that patients can access the services they need to get and stay well. And this partnership also extends, I'm very proud to say, to our critical work in the local community. We've joined forces with the Medical Center to improve health, education, and economic development in West Baltimore, knowing that if we work together, we can be an even stronger ally for our neighbors who need us. So our partnership is incredibly important to us and to the people of the city and the state who rely on us. And I'm confident I can speak for Mr. Chrencik and Dr. Suntha when I say that we will always look for opportunities to deepen our relationship. So I wish our medical center and medical system partners, on behalf of UMB, a terrific Spirit Week, and I hope you'll take some time to get to know your cross-institution colleagues a little better over lunch or afterwards. And without further ado, I'd like to ask University of Maryland Medical System CEO Bob Chrencik to share his thoughts.
My close friend and partner, Dr. Reese, and I coined a phrase several years ago, the power of partnership, and nothing demonstrates it more than what we're seeing here today. So it's a real privilege to work on the medical system side, and I've been involved with it for over 30 years, and it is truly a special relationship. So I want to especially thank Dr. Perman and the entire UMB leadership team for hosting this event. It really does recognize the importance of this partnership and what I consider just a fantastic set of professional schools. What a set of assets here for the state of Maryland. And when we look at the medical system, I often say, read the name University of Maryland Medical System. Our relationship with UMB and the School of Medicine is defining in who we are, and I think just provides us, as we compete in the Maryland healthcare marketplace, with a huge competitive advantage. And as you know, we have a new medical system brand message, be a part of something greater. And I think in many ways this showcases what the medical system is all about. It is very large, it is statewide, and together, when you add the parts together, the whole is much bigger than the individual parts. So 25,000 employees, so it is truly a great asset for the state. But our medical system is, of course, very Maryland-focused, and I think that differentiates us from Johns Hopkins and MedStar. When the day is done, we are all about the state of Maryland. We have over 150 service locations across the state, and we're out there and are totally committed to what's best for the people of Maryland. And again, I think that is a very, very important role here that we play across the state, whether it's shock trauma, cancer center, you name it. And our partnership with the University of Maryland School of Medicine, again, also very defining. Together, we're bringing innovation, discovery, new therapeutic treatments to the people of Maryland, but also to the citizens of this country and even the world. So it's, again, a very special relationship. And then finally, our partnership with the UMB professional schools. We are the ones that together will train the next generation of healthcare professionals for this state. It's not going to be Johns Hopkins. It's not going to be MedStar or someone else. We're the ones that have to get it done. It's a serious, serious responsibility, and also a great asset to train these folks and have them out in the workforce and being our friends and partners. And finally, we are a greater and stronger medical system because of this partnership with UMB. And it really allows us to do things for the citizens of Maryland that allows them to live longer and even greater lives. So again, from Bob Chrencik and the leadership team out across the medical system, thanks for coming out this afternoon. It's very important to us, and I want to thank everyone here, whether you're on the UMB side or the medical center side, for everything you do to make Maryland a healthier place to live in. We are truly a greater collective organization because of you. So thank you very much for having me, and again, thank you for everything you do for the citizens of this important state. So with that, Dr. Suntha, the CEO of the University of Maryland Medical System, going to add a few remarks.
All right, good afternoon. One more time, good afternoon. Good afternoon. All right, thank you. Again, my name is Mohan Suntha, and I am very proud to serve as the CEO of the University of Maryland Medical Center. And while I love that title and the roles and responsibilities that come with that, most importantly, what I love about the University of Maryland is that I have spent my entire professional career as part of the community that is the University of Maryland, both in the School of Medicine, as part of the faculty, as a member of the UMB campus, and now most recently as of September in an administrative role and a management role at the medical center. And so I have now for over 25 years seen the dramatic impact and have been blessed to be a part of the dramatic impact that we collectively are able to make on our community, on the state, and oftentimes on the national conversation about healthcare. And so again, I think when you think about how we are structured, I heard Dr. Perman ask in the beginning, who gets a paycheck from UMB and who gets a paycheck from the medical system, or who gets a paycheck from the faculty practice group. But I think the point of why he was asking that question is that at the end of the day, it actually doesn't matter. It does not matter who's signing your paycheck. What matters is that collectively we are part of something greater, right? So collectively we are, as a team, delivering on a commitment that we have to our community, to our state, and to our country. So academic medicine, I love to say, I believe it to be a noble profession. I believe that our calling is in fact higher, and oftentimes it is more challenging than many of the other challenges that exist in healthcare overall, because while we are always thinking about how we are responsible for delivering the highest quality, best care that we can to our patients, our mission is unique. Because as you've heard, we also are expected to be able to deliver on the education of the workforce, the future workforce of our community, of our state, and of our region, and oftentimes of our country. And we are also charged with the responsibility of not just thinking about how we deliver healthcare today, but what are the innovations that are going to drive how we deliver healthcare tomorrow. Now again, around this city, there is a lot of excitement. And more and more I hear this term that there are organizations in our community that are defined as anchor institutions. And so again, oftentimes when you think of the city of Baltimore, people think of anchor institutions and they think of companies like Under Armour, or companies like McCormick, or companies like T. Rowe Price or Legg Mason. And all of those, I think, are fine examples of anchor institutions. And in healthcare, again, I would argue that oftentimes people think of two institutions as anchor institutions in the healthcare space of our community. One institution I continually somehow can't remember the name of, but I know it's located somewhere not too far from us. The other is the University of Maryland. We are collectively an anchor institution in our community, and if you think about what it means to be an anchor institution, historically in healthcare we may have mistakenly believed that to be an anchor institution you have to deliver amazing care to people when they come to your doors. And the truth is, the definition of an anchor institution are organizations that connect to the community in a deep and meaningful way that goes beyond just the primary mission of why we exist. And so when you think of our partnership with UMB, I would hope that our partners at UMB across the campus would say that we at the medical center and across the system are assuming the responsibilities that are associated with being an anchor institution and connecting to our communities in very meaningful ways. And so when we talk together about this campaign of being part of something greater, I think you can expand that to whether we're talking about the system, whether we're talking about our relationship with the campus. Most importantly, what we're talking about is our collective commitment to the community that we serve. And so again, on behalf of the Medical Center, all of our employees, our partnerships with the campus that are foundational to the jobs that we do and our missions that we serve, I want to say thanks for coming out, and we look forward to continuing this partnership for a long time. Thank you.